And oops, let's keep the recording stopped until we actually begin this. And, so welcome everybody to this session on indicators of quality in school health programs. I'm very pleased to welcome our three presenters this morning, or this afternoon, or this evening, depending upon where you are in the world. We're looking forward to a good discussion. This is a small group discussion, I think, which is really starting a conversation about the draft guidelines. And there will be follow-up in a couple of different venues from here on to gather up feedback for the authors who have done a great job in putting this document together. My name is Doug McCall. I work with the International School Health Network, and we have presenters who I'm going to allow them to introduce themselves in the order they're going to speak, and then we'll take a look directly at the document as we go forward. As you listen, you may notice that sometimes the sound will slow down and then it will pick up in speed. That's because of the data flow coming into your computer. Don't worry about that. It's just the nature of the beast in terms of data flow around the world. And sometimes you might get bumped off the system. All you need to do is just click on the link again and come back in the system, and you'll be able to catch up pretty quickly. If you're able to, if you have a microphone or a computer with a microphone, please do at the time we ask you to make comments to click on the talk button. It's in the upper left-hand corner. A little blue microphone will come on and will indicate that you're live. And then once you've made your comment, if you could remember just to click it off so that the sound quality is maintained. We also have the instant message box, the chat box in the lower left-hand corner. And we can use that to send messages. If there's any time that you would like to get my attention during the session directly, there's a little hand box. If you look at my name, you'll see that I have a little red circle with the number 1 in it. I'm going to be able to notice that, and it will ding in my ear if you're urgently trying to get my attention. Otherwise, just send your message into the chat box, and I'll be keeping an eye on that as we're moving forward. And the last little thing I'll show you at the end of the session, what we tend to do is, if you look under the smiley face, under the participants list under your name, you'll see a little smiley face, and there's a little button there. If you look at my name, you can see there's a little applause section that I'd encourage you to, when the time comes, to thank our presenters. So I'm going to turn the session over to our three presenters, and I'm going to start with Carmen. Carmen, if you could introduce yourself, and then also have Scott and Natalie also introduce yourselves, and then we'll come back to Carmen for the beginning of the presentation.
Hi everybody, this is Carmen Alsinger. Nice to speak with you all. I was formerly with EDC. I'm currently an independent consultant, and I have been part of the FRESH M&E coordinating group from the beginning, and I will talk more about this later. And I'm happy to start us off to our presentation today. And I'll give over to my other colleagues to introduce themselves.
Thank you, Carmen. My name is Scott Polizzi, and I'm a team leader in the section for HIV and health education here at UNESCO Paris. Natalie?
Hi, so I'm Natalie Roshnik, School Health and Nutrition Advisor for Save the Children. I've been working on this M&E framework since 2008. Can I also just take the opportunity to introduce maybe Claire Handry, who's on there, because she worked on the checklists for these 8 indicators. So it's great to have you here, Claire, as well.
Great.
Okay, great. So today, what we're going to talk about, first, I am going to give an introduction to the FRESH framework, to the development of the monitoring and evaluation guidance, and the purpose and structure of it. And then Scott and Natalie will present the 8 indicators, and then we will have some time for discussion. As most of you probably know, FRESH stands for Focusing Resources on Effective School Health. And the FRESH framework was launched at the World Education Forum in Dakar, Senegal in 2000 by UNESCO, UNICEF, the World Bank, and WHO. And on that slide, you can see the cover of the original FRESH document, which was considered a fresh start to enhancing the quality and equity of education. And this health framework was made part of an education conference, which was quite innovative at the time and still is. The original FRESH framework had these 4 pillars or components, they were called in the original framework, and they came from the common elements that the frameworks of these 4 agencies that launched FRESH had. They all wanted to agree on one common framework, and they found these 4 common indicators or pillars that were common to all their school health programs. So the first one being school health related policies. The second one, provision of safe water and sanitation as the essential first steps towards a healthy physical learning environment. And as you will hear, this has been expanded over time to include not just the physical, but also the psychosocial learning environment. And then skills-based health education and school-based health and nutrition services. And these were supported by 3 supporting strategies in the original FRESH framework. So basically, it's school-related policies, school environment, education, and services. That's the 4 components or pillars of the FRESH framework. And so during the early 2000s, the Partnership for Child Development, they conducted some studies in 36 sub-Saharan African countries. And that showed that more school health programs met the minimum criteria. And actually, it was an increase from 8 to 44% in the programs that met the minimum criteria. And also, they became much more comprehensive. And then there was a question in the need for how do we evaluate these. Now you have this FRESH framework. How can we show that we achieved what the FRESH framework asked us? So in 2008, PCD conducted another review, a participative review among many different agencies, and that confirmed that there was indeed a need for monitoring and evaluation guidance for school health and especially for FRESH. So after knowing this, what did we do? Well, we started a coordinating group with about 11 or 12 FRESH partner agencies, and they are listed here. And there were also independent consultants, Claire being one of them, that joined us over time. There were actually 3 different ones who worked on different parts of the draft of this document. So it was quite a lot of work. And the coordinating group, or part of the coordinating group, met 3 times in person. The first one was at WHO in Geneva in September of 2008. That's when this whole effort was launched. And then we met again at UNESCO in Paris in November 2010. And then last year in October, we met in London at PCD. And so as you can imagine, there were many, many revisions over all these years. Many different people worked on it. We did it in addition to our regular work. So as you can see, it took some period of time to do this work. But it really benefited from so many different people who contributed to developing this guidance. And so now we are very pleased to be able to present to you this first comprehensive draft of the monitoring and evaluation guidance for school health. And we are going to talk about part 1 today, which are the 8 core indicators to support FRESH. And this guidance will serve the purpose to provide internationally agreed guidance to monitor and evaluate school health. As you can see, a lot of international agencies participated. So this is an internationally agreed guidance. And in addition, we recommend indicators in particular to assess the progress in implementing FRESH. So we provided the guidance and very specific indicators, which we will discuss today. So this M&E guidance has 2 parts. The first part is the one which we will talk about today. It includes 8 core indicators that assess the 4 FRESH pillars. So for each of the 4 FRESH pillars, there are 2 indicators, one at the national level and one at the school level for each of the 4 pillars. So that's why it's 8 indicators. And then there are also checklists for each of the indicators. And Scott and Natalie will talk about this in a few minutes. And these are the new indicators that our group developed. In addition, there will be part 2, which is not completed yet, which are thematic indicators for 15 school health topics. So these are mainly existing indicators that we drew with the help of many colleagues from existing school health documents. They are still in development, so they are not ready for discussion yet. But now today, we will talk about part 1 of the M&E guidance, which are the 8 core indicators to support FRESH. And I'm going to give it over to Natalie and Scott to introduce you all to these core indicators. Thank you.
Thank you, Carmen. That's a very good recounting of the history and a good explanation. Just to be clear about these pillars, because they're central to how we move forward on FRESH and how we work with the indicators. There are 4 of them. One touches upon equitable school health policies. The second touches on a safe learning environment. The third is concerned with skills-based health education. And then the fourth is concerned with school-based health and nutrition services. The first pillar I'd like to talk about is on the equitable school health policies. And by policies, we're talking about a document or some kind of guiding principles that outline the rules for school health programming nationwide. And the notion behind this one is that without this policy, school health is likely to be deprioritized or unprioritized and will fall in between the mandates of different ministries, primarily health and education. So the driving force behind this one is to clearly articulate the goals and principles and to articulate the mandate to which to achieve school health through policy. So indicator number 1 at the national level, again, there are 4 pillars of FRESH, and we have a set of indicators that revolve around national level, and then a second one that's more school level. And that's the organizing principle for the next set of slides. So indicator 1 talks about the existence and quality and dissemination of a comprehensive national school level policy. So we're looking at the degree to which it exists and to which it's been shared by important stakeholders throughout the national school education system. We're talking about the situation analysis done, about the health needs and whether that the priorities and the policies match up with the health needs both nationally and locally, and a degree to which the pillars are reflected in the policies themselves. So does it touch upon school health and nutrition? Does it address skills-based health education? Does it talk about the safe learning environment? These are the things that we're trying to codify here through policy. At the school level, now it's really the extent, the percentage of schools that have these policies in place and the extent to which they are actually monitored and enforced. And we talk about the priority health concerns because we wanted to reflect the immediate concerns locally. So, for example, in more urban settings, school health policies should touch upon issues around traffic safety, for example. In rural settings, it should reflect issues, concerning feeding and commuting times to schools and things of that nature. So it really should reflect the immediate environment as well as the national environment. And then also, as with the national policy, we are stressing the need for local level policy to address those other pillars of FRESH. And from there, I turned it over to Natalie to speak about pillar number 2, the safe learning environment.
Thanks, Scott. So we're taking it in turns, each doing a pillar. So the safe learning environment, what we mean by that is a safe school environment which protects and promotes both the physical and the psychosocial well-being of children. So, and really we stress on those 2 aspects. So it should be both free from violence, abuse, drugs, alcohol, bullying and discrimination. It should be free of dangerous objects and, have a safe structure and be secure from neighboring hazards, roads and bars. And also, and especially, it should provide potable drinking water, safe sanitation facilities for girls and boys with hand washing facilities to prevent the spread of diseases. So the first indicator to address this is to make sure that there are national school safety standards addressing both the physical and the psychosocial school environment. So this indicator measures whether national standards exist to guide and assess the physical school environment. So by this we mean, are there national standards to guide and assess the water and sanitation situation in schools, the safety of school buildings and structures, and child protection from external hazards. The second one is whether national standards exist to guide and assess the psychosocial school environment. So by this we mean, are there national rules, procedures and codes of conduct that prevent and address violence in schools, and standards for ensuring schools are welcoming. And then the third one is the quality of these standards. Are the standards based on evidence of priority health needs and issues in schools? Do they reflect the distinct needs of different groups of children? And are the standards user-friendly and accessible? So indicator 4, which is the school level, which similarly to the first two sets of indicators, is the percentage of schools that meet the national school safety standards. So while there might be national standards that exist, it doesn't mean that these standards are met at the school level. So this indicator measures the extent to which schools meet the safe learning environment standards, physical and psychosocial. So this will include, are there sufficient number of latrines provided and maintained? Are they supposed to, and are they used by, or do they meet the needs of the girls and the boys? Are there protocols to deal with bullying, and are they well understood and implemented? And looking at the complete list of minimum standards, physical and psychosocial, how many does the school comply with? The second point is the extent to which the school leadership and staff are aware of and reinforce the national standards for a safe learning environment, physical and psychosocial. So by this we mean, can staff describe the standards for a safe physical and psychosocial learning environment? Do staff receive training to develop their awareness of the safe physical of the standards and where relevant how to implement and develop the standards? Are staff and other partners actively supporting, maintaining and enforcing those standards for safe physical and psychosocial learning environment? So, and then the third point is the student and parent and community perceptions of the school providing a safe learning environment. So this I'm going to pass it back to Scott for the third pillar.
All right, thank you, Natalie. So with skills-based health education, there are two main concerns. One is the content, and then the second is the method of delivery of that content, the way the learning is done. And we are talking about a skills-based pedagogy that must accompany this content. So this is going to be reflected in the curriculum, teacher training, and learning assessments. That should capture the two main components that we're measuring here. When it comes to the actual content, we're going to stress the scope and sequence of the content to make sure that it builds upon the different topics that come before and after it, that it's reinforcing, and that it's age appropriate, so that there's a continuity and a structure that focuses on bridging skills between what's needed at the primary and secondary levels of education. We talk about this pedagogical approach that is interactive, learner-centered. There are different terms for it, but essentially one that is going beyond simply didactic methods focusing on knowledge, but develop skills so that young people can adopt protective behaviors. And then in order for this to occur, teachers need to be trained in this methodology. They need to be needed to be very fluent in the topic areas, so they can talk about sensitive subjects that may come up, particularly around sexuality education, but they also need to know how to manage interactive skill building sessions, which are very, very different than primary didactic training, which is what most teachers have received. The final component of this one is the degree to which teachers are able to evaluate these aspects of the learning. So we're calling for different assessment rubrics in this case, something that goes beyond, let's say, a convergent type of thinking with a single answer that might be done on a scan sheet, but rather multiple answers in situational and interpretive learning. That's central to this approach. So at the school level, we're really talking about coverage of these two things, whether the curriculum is there, whether the appropriate content is there, and whether teachers have the commensurate skills to teach it. So we're talking about distinct health lessons that can occur, or health messages that can be infused across several topics, the linking of these topics to each other, and then whether or not the topics that are taught in class reflect the policies we talked about earlier, and any kind of situation analysis that was done to create that policy. So we want to make sure that the local conditions come through very clearly in what is being taught in the classroom. And then the second point, again, is to make sure that the materials are in place, meaning textbook and curricula, but very critically, the in-service and pre-service training is there so that the teachers, new and existing, have the skills in the classroom to elevate their learners and use these interactive, innovative approaches in the classroom, and also to do evaluations using these innovative rubrics that we talked about earlier. And for the final pillar, I turned it back to Natalie.
Back to me. So really for school-based health and nutrition services, the education system really provides a highly effective system through which to provide key health and nutrition services for school-aged children and address some of their needs and problems. So now which service should be provided in schools, of course, depends on the national and subnational health and nutritional priorities of this age group, and of course the relative cost and ease of administration of the services through the education system. So, we have, and these will vary a lot by different countries and contexts. Now, if I go to so the indicator here is that there is a minimum package of school-based health and nutrition services that has been defined at the national level based on local health priorities and cost effectiveness. So what this measures is whether a package of school-based health services and nutrition services has been defined and recommended at national level or within a national strategy or policy. Secondly, that the extent to which the recommended package of school-based health and nutrition services is based on a national and regional health priorities and needs. So is the recommended package of services based on a rigorous assessment of the needs of school-aged children across the country? Has there been a situation analysis to figure this out? Does the package address the needs of different groups of children, ethnic minorities, younger children, adolescents, girls, orphans and vulnerable children, etc.? And then thirdly, the extent to which the recommended package of school services is cost effective. So are they affordable and easy to administer through the education system? Do they address priority health problems that affect a large number of children, and is there evidence to suggest that the interventions will improve children's health and education outcomes? So now for the school level indicator is percentage of schools where the minimum package of school-based health and nutrition services as defined at the program national level is provided. So here, this indicator determines the extent to which the minimum recommended package of school-based health and nutrition services and each element within the package are provided in schools. So is the full recommended package available at the school? Which elements of the recommended package of health are available at the school? Secondly, and the second point is the capacity within schools to deliver a minimum package, this minimum package of services. Have staff been trained to deliver these services? Are staff who are involved in the delivery sufficiently supported by the health system? What are the linkages with the health system? And then the third point, which it determines the students, parents and other community members' views on the provision of school-based health services. So do the school health services meet the physical health needs of students? Do they feel that they meet those needs? Do the services meet the psychosocial health needs of the students? So those are all the indicators. Now this is the work really that Claire has worked on, and Claire Hanbury, who's now on the webinar. So Claire, if you do want to add after I finish this, please do. So the way, I'm sure most of you will ask, well, how are these indicators collected? So the national level indicators is mainly collected through a review of all the national level documents, so policy, strategies, standards, etc. So really it's getting someone, a consultant or someone who is able to do this, to really sit down and review all these documents using a checklist which Claire has developed, which is still currently under review and finalization and will need to be piloted, using checklists to, asking specific questions, which I'm going to show you examples of afterwards. And then the school level indicators will be collected through a survey in a representative sample of schools, so representative of schools across the country. So, we'd have to have schools from the different regions, the different community schools, public schools, etc. And using, again, a school checklist or questionnaire. So here, the next slide gives you just an example, and this is, for example, the nationals checklist. And you just have a few questions. I've just put some of it just so you see what it looks like. But again, these will be adjusted probably in the next month or so, and then need to be piloted. So this is the kind of checklist that the consultant who would be collecting the national or revising the national level indicator would go through and try and respond to these questions when reviewing the document. So for example here, one of the questions to assess if the existence of national standards, if there are national standards to guide and assess the physical school environment, the question is, are there national standards? And 0 is no, 1 is minimal features, 2 features at least 4 of the criteria below, 3 featured, etc. And then, there are lots of, this is actually when we get really into the nitty-gritty of what we mean by school health, what we mean by a school health policy, and so on. So I'd say this was actually one of the most difficult parts of the work we've done. So here's the second one is an example of a school checklist, which more looks like a school questionnaire, where it would involve, for the safe learning environment, for example, involves observing the school environment, talking to staff, and asking questions and responding in a similar way. So the next steps now with this M&E guidance for FRESH generally is that we want to pilot and test these core indicators and checklists. So we are looking for sort of volunteering agencies, networks, school networks, anyone who would be interested in piloting these indicators. So please let us know if you're interested. And then the second major task is to complete part 2 of the M&E guidance, which really is a compilation of all the existing indicators recommended in various documents. For example, there's a deworming in school-age children with indicators recommended there. We have HIV/AIDS and education indicators. So it's compiling them all into one document, and so there are still quite a few gaps which need to be completed. So that's sort of the next big task. So if anyone is interested in supporting and helping, you're most welcome, because it's always been a struggle finding time to focus on it. And if you have any comments, so the document is on the website, the UNESCO website, and if you are able to review and send comments and suggestions, it's still a draft document. Please send them to this email address, info@IITT. Claire, can I pass it on to Claire because I think she's got something to add. Go on, Claire.
Hello. I see from the comments on the chat room that there's a concern that there are a lot of indicators. I just wonder whether the people who are commenting on that have had a chance to have a look at the checklists, because when you presented it, we only saw the top part. But in most cases, the numbers of the indicators, there aren't that many. There are like, isn't it, Natalie, about 3 or 4 indicators. When we were working on this together, we were really trying to keep aware of the need for a real simplicity. So I think that we only saw the top bit on the whiteboard, but there are only about 4 or 5 indicators per checklist. Yeah, maybe we could have a little, can you scroll down so that people can see the scope of that checklist?
Yeah, unfortunately, I didn't include, I only just copied the top just to see what it looked like. But basically, as you see, the point 1, the existence of national, so the questions that are in the 3 questions that we ask in under each indicator, there are like 1 or 2 or 3 questions under each one of those, right, Claire? And so, you know, yeah, I mean, as you say, Claire, I mean, it was just a struggle to finding a compromise between simplicity and making sure that we assessed it in a comprehensive way at the same time. Now, I haven't shared them because that we have sent these to the advisory group. There have been comments, and we feel that we need to just adjust them a little bit and make sure that they are in line with the now indicator definitions, since changes have happened there, before we send them out more broadly. But if anybody wants to see them, please, you're welcome, and we can send them directly to your email.
It's Doug here. Thank you, Miret, for the comment, and I think that's one of the challenges. I'd encourage other folks to either within the chat box ask a question or a comment, or click on the talk button and we can hear you directly. I had a question maybe as people are doing that for the panel, and that's really how the document might be used after it's been refined and revised, how this document could be used in a country or perhaps even a group of countries. How do you see that happening, and talk a little more about the process of how the tool can be used.
Who's Doug, could you just ask the question one more time?
Yeah, just how, once the document has been approved,
yes.
How would it be used in a country? There was a little bit of that in your presentation, but
Yeah.
how it might be connected to other tools, such as there's 2 global surveys that are used quite often, the HBSC survey, the Health Behaviors in School-Aged Children survey that's used in a lot of countries, and then also the Global Student Health Survey that's used in another set of countries. How could those 2 tools be used together, or could they be used together?
Yeah, well, we actually had a discussion just recently with the advisory group, because they, in fact, a similar question came out from them, and we have to work on just making sure that we're asking the same question. But the main objective for these is really connected to FRESH and government and the progress towards implementing FRESH at national level as opposed to project level. So it's for government to, and I think, you know, NGOs like Save the Children I work for, you know, can help government do this, to figure out to what extent are they implementing FRESH based on what we define FRESH to be. So I don't think that hasn't been necessarily the objective of these other surveys. But that said, I think many of these other surveys like the Global School Health one has been, you know, many of the questionnaires have been piloted, and so on, so that we need to, as much as possible, draw from those surveys and make sure that, you know, where we can use the same questions we do, especially for the survey, the school level questionnaire.
Okay, thanks. Further questions or comments, please add them into the chat box or click on the talk button. While we're waiting for that, I'll take a liberty. I haven't had a chance to really read through the document, but I thought, actually, Natalie, could you just turn off your mic? I'm getting echo. Yeah, and then click it on when you. Thank you. Great, and Scott, if you could add too. I had a question. just based on our work around capacity. And this is, I have first of all have to say the document is excellent. I was involved a little bit at the beginning, and you've done a wonderful job in putting this together in a comprehensive and cohesive way, and kept it at a manageable level, which I think is a real compliment. And also really like the multi-level, the national and then the school level. I think that's important to keep in mind as we're talking about systems, both school systems and other health systems that are multi-level in nature. So congratulations on those two aspects. I guess the question I had, and I'm not suggesting having another document, but our work has been focused around capacity these days quite a bit. And you may recall a document that EDC did with WHO, Carmen was involved, that looked at different kinds of capacities. The capacity to coordinate, the capacity to monitor and report, the capacity to develop policy. And I think one of them is vitally important, that it perhaps could be taken from another source or done in a different way, and that's the capacity to coordinate these multiple interventions at a national level, at an agency level, and a school level. And given the nature of this document, it doesn't really fit here. But I think that kind of complementary document needs to be developed, so people look at this checklist of interventions, very well done, and multiple interventions, and then also look at the capacities required to implement them. And so that would be one comment that I would offer later. But maybe Scott, can you jump in here?
I think I'm looking at the chat box, there are a lot of really good questions about validation, about costs, about level of measurement, and how does this compete with other indicators that are out there. And I think these are really a lot of good questions, and I'll try to address them by saying that for at least the 15 years I've been working in school health, we've had this notion of everyone having their own notion actually of what school health is. And I think there have been a lot of competing ideas, and it really depends on, I guess, your background to which you project onto school health. But it's been never fully articulated until FRESH came along, and then FRESH, in 2000 came along and put it out as a comprehensive approach, and it addressed in-learning, it addressed policy, it addressed the environment, it addressed services, things like this that were really each handled by different domains. And for a while, FRESH existed conceptually, but it didn't really have any vehicle to take it forward. And we think that and all the partners in FRESH were working in school health, but each in their own bit. And the indicators came about to try to bring structure to the discussion. And it's not something that anybody's trying to mandate on a country to do, but rather it's trying to articulate what school health is in a practical sense at a national level, at a school level, on all these different aspects of school health, and for it to be understood by the implementers, what resources would be needed to achieve this. So this is what we're trying to get to with these indicators. It's really the first time. FRESH has been around for over a decade now, and it's really the first time that we've been able to state clearly what we mean by it. And I think this is where we're starting. It's a slow process, but all these questions people are asking about how does this compete with other instruments, I think that's just dead on perfect to know. And part of our thematic indicator development is really drawing on a lot of the existing things. There are WASH indicators which deal with water and sanitation. There are health and family life indicators that deal with skills-based education. And we're trying to make an instrument to bring all of these together in a way that you can use existing things, but we're just trying to really paint a larger picture. And then there was a question here about things such as validation. I think that's what Natalie's getting at. We're really at the very beginning of the process. We're not saying this is the end. We're not putting this as a definitive list. We really want to test and validate and adapt as necessary. But we believe, and all the FRESH partners believe, that the framework is sound, those 4 pillars. And what we're trying to do is bring a degree of rigor to them by introducing these indicators. But we're really would love to take this around the globe a few times and kick the tires, to mix metaphors. But yeah, that's my contribution on that point.
Thanks. There are now a number of questions in the chat box. Can we look at and I think Scott's addressed them generally. Is there a response from Carmen or from Natalie about Elle's question about linking with UNICEF's documents that he or she's referred to, the CFS, the Child Friendly Schools document, or the Life Indicators? I think Scott's addressed that a bit. And I guess it goes back to Murad's question: how can we sort that through, or does that really suggest that countries need to sort that through before they start this process?
Yeah, thanks. You know, this is the question that often comes up. I mean, the Child Friendly School Initiative. I mean, FRESH came about to try and harmonize between all these different sort of health promoting schools and child friendly school initiatives. So it really, and there's nothing different about it. It's just presented in a different way in terms of the 4 pillars. Everything that's in the child friendly schools is in the 4 pillars, maybe more health focused. But in terms of the indicators, and I can't, of course, I mean, Claire, I think you looked at these various indicators when you were developing the checklist. But I think that one big difference between many of these recommended indicators or indicators used are that they are project level indicators, whereas this is sort of really looking at national level progress towards implementing FRESH. So it's not looking at the impact of FRESH or impact of a project implementing school health. It's really the extent to which FRESH is being implemented. So it is different in that way. Claire, would you like to just add in terms of what other surveys you consulted when you were developing the checklist?
Hi, it was mainly FEBER, wasn't it? But we talked to various people about some different topics as well. But in terms of an actual checklist, I think it was FEBER that we mainly consulted. And we tried to get hold of the child-friendly school stuff, but I think that wasn't quite ready. I'll have a think and I'll put it on the chat room, Natalie.
Okay, thanks. And else, in terms of the Save the Children Quality Learning Environment, school health actually was included in there, but it's really for the purposes of Save the Children that one, even though, you know, we're not saying anything different. In terms of consultation with those, okay, I think, who is the sample? Diana's question on who is the sample at the national level. You know, we haven't got to that stage about how to sample the schools. We were really hoping to draw from some of these global surveys in terms of how to do that, and we're hoping to work with the WHO Global School Health Survey, who've done so many of these surveys, at least for the school health indicators, to figure out how to do that, and the pilot testing and so on. I'm just going through.
Yeah, just to pick up on the question from Murad's question, the latter part of it, where he's commenting about needing a tracer indicator, for example, easy to monitor from if 90% of the children wash their hands after toilet use. That's where I think those other surveys, which are more student surveys, as distinct from this tool, which is looking at national and school policies and programs. I think that's an important distinction to make, that the behavioral data and the health status data comes from other sources, which could be correlated in a country, but I think this is focused more on the policy program status. Am I correct in answering it that way?
Absolutely.
To the question from Diane, even though the framework is still a draft, it's already been very helpful to the work we're doing in Tanzania to support a school-level pilot project. So this is already a benefit from the work that's been done. And so Diane is looking for ways of trying to stay involved and informed as things progress. Certainly I would offer our support in trying to keep an ongoing discussion going. But Scott and Natalie, do you want to comment about how the process might move forward in keeping people involved?
Sure.
Yeah, sorry. Yeah, sorry. Go on. I was looking for the
Okay, go ahead.
Yeah, no, I mean, I think what the plan was this document is now on the UNESCO website, so we sort of invite everybody to comment and to read it and really comment on it, especially in the next month or 2 months. We also take the opportunity of any kind of an international conference, abroad and so on to present and share the indicators, and we are also looking for volunteering organizations to pilot, and I think that will really be the moment when we see how they work and what needs to be adjusted. Save the Children has volunteered, at least we are ready to pilot some of these indicators. I think UNESCO as well, and it would be great to have others. I see that Song is putting her hand up, so Song, would you like to talk?
Song took her hand down. Yeah. No, I think just to echo what Natalie said, that there have been some questions here about can other people comment on it. Definitely on the last page you can see there's an email address that you can write to with your comments, and then I've pasted in the discussion box where one can download directly from the UNESCO site the PDF version of this document. So between the PDF and the mail address, you should be able to get comments to us, and then Doug also said he would put it up on the network website. So there are two ways to get in touch with us. But we definitely welcome comments and your stories of application. Thanks.
Yeah, and just to add, I also just want to say that where we want, I think we really need to take it now to the country levels. So again, I think we'd like to invite as many organizations who are working in school health at the country level to use this to have a discussion about school health with the Ministry of Education and Health, and see how we can support the improvement of advancing national school health program in general in the country. So, it's a great tool, but as we use the tool, we can test it. I think we're leaving quite a long period of time for the pilot testing. About a year, I would expect, but we haven't quite decided this.
I see Susan has added a comment about how this is in line with the work that's being done in Canada by the Joint Consortium, and maybe that's generalized from that point is if there is a national initiative underway, that this tool can be added to it and modified with that and connected to it, so that both the national effort and the international effort can be linked up and benefit from both. Susan, I hope I'm capturing that adequately and making that point, and I guess that's really the next steps, is to get countries who are already working. A couple of years back, we did a series of sessions with looking at different systems for monitoring and reporting, and of course, the larger countries like the United States have quite elaborate systems that can use this more for comparative purposes. But so I'm looking now to Lisa's question. Did you say the end user for these tools and indicators are governments to evaluate themselves? Maybe that's a point that we could talk, and it was raised a little bit earlier in terms of the quality of the data. How can Scott or Natalie or Carmen respond to that point?
Yeah, I mean, I think it's to assess, the level of national level effort to implement FRESH, but I think who actually does the assessment I think it needs to be a discussion at the national or the country level. It might be an organization. I mean, ideally there does need to be some objectivity. I would say that, the national level indicators need to be done by an independent consultant or organization, and then the school level, I mean, as well, if possible. But I think it needs to be done as much as possible together in partnership with the government, so it's something that they want to do, not just others want to do.
And Els, in his comment, is expanding on the comment talking about involving the wider group of critical friends for further inputs, and so maybe that's something that could be thought about in the document as a way. There is a time when governments need to look at data by themselves, but there's also a time when they're very interested in receiving out, feedback from others, and so there's probably some kind of balance that might be achieved in the process within each country. Claire has answered a little bit about that in terms of the feedback. I guess I'm looking at Elle's question there. Who provides answers to the questions in this in the checklist? Is there any triangulation? That's going to a little bit about the methodology, which I think, Natalie, you've already said it might be. It's still in the needs to be thought through, probably differently in different contexts. But does Scott or Natalie or Carmen, do you want to respond to that point? Carmen, you might also talk about the experience you had with the WHO RAP tool as a process based on the work. I think you were involved directly in that, so that might be something as well, that since it's an experience that's a few years old, but at the same time it is a process that's similar. So Natalie, Scott, or Carmen?
I can speak to some of those things. I think this can be done as an evaluative tool for sure, and as you point out, the respondents will make for the quality of data. But I think on the front end, it's also very important in terms of planning for programs and policies. And I think that's where, essentially that's where at first we have our value added, because we're articulating a very concrete program design for school health, for policy, for implementation. And I think this is where we can initially make an impact, and I think we need to test and further refine, of course, for sensitivity of measurement. But I do think on the front end it has a tremendous value. And reflecting on RAP with WHO and the work in school health, the consistent issue that we came up with in Indonesia, Nigeria, and Gujarat was this lack of mandate that schools had when it came to health issues that involved things like infrastructure, that health services, things of that nature. And what we're really trying to do with this document is to bring everything down in a concrete way to the school level. And then those mandates and priorities and shared resources have to be worked out, and that can only be done on a case-by-case basis. But what clearly we saw in all of those instances with working with WHO was this way that school health fell through the cracks or was only addressed in part. And I think that's what we're really trying to address here, is to really make a very cogent and clear picture for school health that is overarching, that is interconnected with a lot of aspects of the lived lives of learners.
And Claire, do you have something, do you want to add to that comment? I see your hand was up.
I just wanted to say that we did develop a very simple, like 3-page guidance on methodology to go alongside the checklists. So it's important that people have a look at that as well when they're looking at the checklists, and then it'll make more sense, some of it. Because we've got quite an interesting methodology that we discussed together, particularly for the school level, on getting groups to define answers to specific questions. So it's worth having a quick look at that. So I'm not sure about the triangulation point that Elle's raised, but there is some methodological guidance, but it's only starting points. And as Natalie said, the next step is the pilots, really.
Okay, thank you. And thank you. Maybe first of all, indicate that we will be following up with, we've created a little bit of a doodle list of people who are interested in this issue, in this document, and so we'll send out obviously a report from this discussion. It'll be a recording as well, and as Scott has indicated, we'll post the document on our website, which is where people are able to comment into it, and then we'll collect that feedback and forward it to Natalie and Scott. And we're also thinking that there may be an opportunity for other conversations about some of these aspects, and maybe around methodology, and that people might be interested in having a conversation about, and then again forwarding it into the process. So I'm hoping this is not a huge number of sessions, but perhaps a small and ongoing conversation. Okay, so I'm going to ask if there are any further comments. I see one from where is it? It's somebody asked, when will the thematic indicators be ready? Maybe Natalie or Scott, can you answer that?
Well, 6 months ago. You know, it's been a while. I mean, one of the biggest challenges with this, and this is why it's taken so long, is that it's been, you know, that we've had 3 consultants for very specific periods of time where they could dedicate their time on it. But other than that, it's been, you know, just representatives of organizations working on this over their full-time jobs. So there hasn't been any, you know, dedicated funding or people to this work. So it's really when we have time to work on it that we, you know, it's really our top priority. So we hope that within the next, you know, couple of months that we might be able to complete the gaps, at least enough to put it up for review and completion, you know, to fill the gaps. The problem with the thematic indicators that they are still, it's very, you know, there are 15 different health topics with over 150 indicators across all these health topics, all drawn from existing guidance. So, and we need to check with thematic experts for each of these health topics to just make sure that they're happy with them and so on. So it's quite a bit of work, of coordination work. So, you know, hopefully within the next 2 months, we should have something for review.
Okay, and that may end up, if I may end up being maybe a series of conversations about those different themes. I know each of them deserves time and attention, and I know how complex and thorough people want this to be. So there may be, again, chances to have mini discussions about some of those themes as they are developed, rather than to try to do all of them all at once. That was my initial comment.
Yeah, absolutely, Doug. And also I have to say that some of them are much further ahead than others. I mean, like, for example, the HIV/AIDS and education indicators, which Scott could speak about, they've been validated and everything. So they're not actually open for review anymore because they've gone through that all already. Whereas there are other areas where really that process hasn't taken place at all. So they're just drafts. So, but in any case, I think it would be great to have webinars to share them and to work on, you know, look, you know.
Perfect. That's great. Okay. And then I'm seeing there's other comments about logic models and so on. I'm going to suggest that we maybe we try to finish up with this initial discussion, because I think this has been a very good start. And Scott has added the shortened URL to the link, and we'll follow up with that link as well. So one thing I would ask people, and everybody should have my email address, and I'll forward them on to Natalie or Scott, is if there's an aspect of this you'd like to talk about further, for example, the question of logic model, or if there's a particular aspect or a particular thing that you might want to bring into the conversation, feel free to email that to me, and I'll pass it along to the planning group. And we can move forward in a small way in terms of bits and pieces. Or if there are other work that's already ready, that might be another way of proceeding too. That's good. So I wanted to, on your behalf, thank our 3 presenters today. And just to remind you, if you look under the smiley face right under your name, you'll see a little applause button, and I ask you to join me in thanking our 3 presenters for the remarks and their thoroughness in starting this conversation, and looking forward to our next session. I will be sending out the link to the recording so that people can come back to it, and I will post these slides as well as the document. So again, thank you to Natalie and Scott and Carmen for this great, well, first of all to Natalie and Scott and their colleagues, to Claire for the excellent work. I know how how long it took, but it also takes that long because it's complex work, and so you've done an excellent job in moving it forward to the stage that it is now. It's an excellent document, a very good piece of work. So thank you to all of our panelists, and I'll close up the session now on time, or close to being on time, and look forward to subsequent conversations by email or by through another couple of webinars. To exit the session, please go under Tools